Hello, everyone. Welcome to a new episode on our People Power Insight series. And today I am really excited of having a new guest. Dr. Wendy Dean is here with us today. Dr. Wendy, thank you for joining us.
Thank you. It's such a pleasure to be with you.
So, the first question that we usually ask our guests, Wendy, is if you arrive into a room full of people that you haven't met, that you don't know, how would you introduce yourself in that room?
Ha. Um, I've been I've been described many ways, and I think my favorite description is as a restless innovator. Some people have labeled it a disruptive innovator, which also probably fits. But it's been across many different aspects of what I've done with my career. So I think that's the way I would introduce myself now. That innovation, that restless or disruptive innovation, is now focused on addressing distress in healthcare workers.
Thank you, and I love that description, and I am sure that we will be connecting a lot during our conversation. Okay, so then you are currently working in which part of the country?
I'm in Pennsylvania, so on the East Coast.
Pennsylvania. Amazing. And one of the things that we wanted to discuss is recently, last month, it was the first anniversary, the 1 year anniversary of a book that has been very relevant, very important for a lot of clinicians in the last year. And that's If I Betray These Words, Moral Injury in Medicine, and Work So Hard for Clinicians to Put Patients First. And I would like to ask you, Wendy, because I know that maybe a lot of the clinicians that will be listening to this conversation, maybe they haven't heard that concept, the word. How would you explain what moral injury is and how it's different from burnout, for example?
Yeah, we just wrote a paper about this. So if folks really want to get into it, they can go and find our a paper in Federal Practitioner. But the concept of moral injury arose from clinicians who were working with veterans from the Vietnam War. And these veterans were being treated for PTSD. They've been diagnosed with and were being treated for PTSD, but they weren't getting better, even with these therapies that were known to work. And so Jonathan Shea, who is a psychiatrist working with them, took a step back. Like any good clinician, he said, okay, if we've made a diagnosis and 2 or 3 or 4 or however many therapies that we know work for this diagnosis aren't working, the responsible thing to do is to go back and reconsider our diagnosis. So Simon Talbot and I had been looking at burnout, and what we thought was we've been assessing this and trying to address it for half a century, and we've hardly budged it. Maybe it's not, our distress isn't entirely about burnout. And so as we talked to clinicians, they kept saying, I work hard. I expected to work hard. I signed up for that. And I signed up to see impossibly difficult things. What I didn't sign up for was to meet hurdle after hurdle in getting my patients the care they need. So that to us sounded less about the individual who is suffering, as having this frailty, this resilience deficit. It was more about, I know what my patients need and I can't get it for them. And that sounded like this concept of moral injury, which is, I know what my patients need, and because of things outside of my control, I can't get it for them. So, if you want the specific definition, it's betrayal by a legitimate authority in a high stakes situation that then leads you to transgress your deeply held moral beliefs and expectations, which in healthcare are those oaths that we took to put our patients first.
Exactly. No. Thank you for that definition. And it just resonates with me, that concept of transgression, because that's really like a key word in the whole concept of this moral injury. And I wanted to ask you, Wendy, when you were like at first thinking, when the first idea came of writing a book And I may have heard this story in an episode of the podcast, but I would like to see if you can share some of it with our listeners. How did that first moment of let's write this book started? How was that?
So it's a great story. Simon and I were having dinner with Sam Shem, who is the author of The House of God. We were at his house. He was reviewing the galleys for one of his books. He knew about moral injury, and he really believed in the concept. And at one point, he said, "You should write a book. Like, people need to know about this. You should write a book." And I burst out laughing. Like, a book was never something on my bucket list. It was like, I enjoy writing, but the thought of stringing thoughts together for 70,000 or 80,000 or 100,000 words was just overwhelming. But Sam, man, he would not let it go, and he kept after us, and really pushed us to write the book. And so it really is thanks to Sam that we followed through.
Amazing. I don't know, thank you, and thanks to Sam for being clear in that. Now, there are several stories because we can definitely see how moral injury will be could be seen and understood through the light of different stories. And I remember some of the stories that are mentioned in the book with Dr. Jerry and with Matt and some other characters that you mentioned in some parts of the book. But I was wondering, is there any particular story from the book that you could share with us now that stands out as a powerful example so that our listeners could relate to that story now?
Boy, I mean, every chapter has a powerful example, but I think one of the ones that really hits home. So Matt Ramsey is the archetype in chapter 1. So I really encourage people to go and read that, because it tells the story of why somebody goes into medicine. They can also have a continuation and sort of learn more about Matt in our new podcast, 43cc. He's my co-host. But when I think about sort of what moral injury, the essence of moral injury, I think about Rita Gallardo. She's a hematologist oncologist who served in the U.S. Army. She was deployed to Landstuhl and then to some other international bases. Like, she understands the concept of service. She understands the concept of an oath. She understands the concept of working incredibly hard in very difficult circumstances. And when she left service and came back, she went to work for a large hospital corporation or a large hospital system locally. She wanted desperately to serve her rural Midwestern community. And she quickly realized that she couldn't refer patients outside of her system because that would allow revenue to escape. So patients weren't going to get the highly specialized care that she thought they needed. So she quit that service. She quit that system. And she went across town and she joined another healthcare system and ran into exactly the same problem. And she said, this is not why I went into medicine. So she left. She left both of those systems and she went and set up her own practice. Now, what that required of her was personal sacrifice, because she took on all the risk. She took on all the effort. She ended up having to sell her dream farm that she had worked for, that she had imagined when she was in the desert in Iraq. And yet it was worth it to her, because now that she is in her own practice, a direct primary care practice, she is able to have that one-on-one relationship with her patients and to choose the kind of care that they get. So she experienced she had an intense experience of moral injury. I am transgressing my deeply held beliefs. I believe that my patients deserve better care than this, and I can't get it for them within this system. And then she found a way to solve it. And she moved out into this practice where she has control.
Okay,
So I think that's one of the, I think that's the story. The story end is not quite as satisfying as I'd like it to be. I would like her to have a better end, but she is working towards that. And there are all kinds of other stories in the book that, if there's a favorite that you have, we could talk about it. But there are a lot of great stories. And I'm so grateful to all of the physicians in here who were brave enough to tell me their stories, and who had the courage to fight back and to find a different way.
Now, talking about the facing this and fighting back, there is this whole concept that we know about resiliency, right? And that at some point we may, like, some people could say that resiliency is related to being able to face all of these issues and going forward and in continuing your pathway, etc. But how could you connect if we are talking about people being able to overcome these issues and to continue and be like the concept of resiliency being around the experiences, how can we connect those two into the same space?
So I think part of the challenge of the rhetoric that's been around burnout is that it is a lack of resilience. And in fact, Colin West and his colleagues in July of 2020 published a paper in JAMA that said, effectively, physicians are significantly more resilient than the average employed population. Moreover, that paper also said resilience did not protect them from burnout. So there's something else going on here. And I think we need to look at, I think in some ways, the physicians that I spoke to for the book are resilient in a myriad of ways. Some of them are unbelievably resilient in being able to stay in situations for the benefit of their patients, solely for the benefit of their patients. They have found ways to remain in incredibly difficult situations because their patients mean so much. That is a type of resilience that I think we don't appreciate very often. There are others who said, my resilience comes in my ability to be resourceful and to find a third way through this madness that I'm facing, which is the healthcare system we've created. And so that ability to keep looking for an answer, a different answer that's good for patients and good for clinicians at the same time, I think is wildly resilient.
Yeah, no, I completely agree with you. And my next question is related to how can we understand the role of healthcare leaders and the support that we can provide to each other to mitigate and to work and solve this issue of moral injury and its effects. How can that be achieved?
Yeah, so that's such a great question, because that's a lot of the work that we're doing right now, is to recognize a couple of things. One is that executives and managers also experience moral injury. We actually did a study about a year ago that showed that about 40% of them during the pandemic experienced some level of moral injury. So this is not just a clinician problem. This is a healthcare problem. This is a healthcare workforce problem across the board. Acknowledging that medicine is a difficult place to work, healthcare in general is a difficult place to work. We will come across these difficult situations. Preparing everyone for them, both leaders and clinicians, is essential. Finding ways to support each other through it is really where this is going to come out. Having systems that are just, right? Who look for lessons learned, not blame, who are human, and recognizing that this is a tough place to work, and it is going to be hard for us. How do we support each other through this? How do we help our leaders be courageous in not only hearing feedback from within, but also to push back without their or outside of their organization. So when legislation or regulation is proposed that's going to harm the workforce, how do they push back against that and stand up for their workforce and have their health workers' backs? Those are all the things that I think we need to start a conversation around. And if we can get past this idea that it's an us versus them, that it's clinicians versus administrators, the better off we're going to be.
100%. I completely agree with that. Okay, now that you were mentioning those concepts, I want to ask you, and it's impressive how time starts to run away from our hands. But what kind of advice could you share with clinicians that are currently struggling with moral injury, but that may feel powerless to do something? What advice could you share with them?
Yeah, I think the first thing is to know that it's not about you, number one. This is a difficult system that we've created. However, we've created this system, which means we can change it, right? Like there is nothing monumental about this our healthcare systems. We have made it the way it is. We can make different choices. The best way to do that is to have, when you're renovating anything, the best way to do it is with the blueprints in front of you, which is why I wrote the book the way I did. Not only to tell us where we are, but how did we get here? So that we know the choices that have been already made, and we can sort of build on that and not retread old ground. I would also say that you're not alone. This is lots of people are experiencing this. So find your coalition, find the thing that you want to change, because the good news, the bad news is that healthcare is super broken. The really good news is that healthcare is really broken. So wherever you start fixing it, it's going to be better. So find your coalition, pick a thing, and start acting. Because as Don Berwick from the IHI said on our very first Moral Matters podcast, a long time ago, like I think it was October of 2020, he said, when you're feeling hopeless, act. And I really think that is where we need to move to. Action.
It's really impressive that you mentioned that, because one of the things that we at Build Power Health share with clinicians when we work with them is that all the relationships that you can build and all the teams that you can prepare and all the strategy that you can develop, it amounts to nothing if you do not take action.
Correct.
So that's a really important part. And now that you're mentioning about this, I have a follow-up question. How, after all the stories and all the people that you have met and your own research, how do you think the future is going to look like? In 5 or 10 years, what situation will we look at?
I am a relentless optimist, because if I'm not, I can't do this work.
That's right.
So I hope that we are going to, I have two visions. One of them is the dark future, which I make legible, that is possible if we don't act. It is not pretty. We're overwhelmed by the silver tsunami that's coming. People have fled healthcare because the work environment is too difficult. But that's the dark future that I don't want to steer to. I want to steer towards the brighter future, which is we recognize that this challenge is not about the health workforce. It is about the environment that we've created, and we can change that. And if we have legislation that closes some loopholes, that provides some support, some regulations that also support the workforce, some changes in what we believe is a better relationship between the business side of healthcare and the clinical side of healthcare, I think we can get to a place where clinicians are happier, patients are happier, they're better cared for, and we're still, healthcare is still solvent, right? But we need to start acting now, like right now.
Yeah. We are running to the last few minutes for conversation, and we usually have a last bit of quick questions as we wrap up. So one of these questions usually is, which book would you recommend people to read? But in that case, I will step up and say, please, you haven't read, if I look for it and get it in this first year anniversary, and you need to read this book. But the second question that sometimes we ask our guests is, what other piece of media would you recommend, for example, a podcast? And I know you have been part of several podcasts, but I would like to ask you, if you could recommend people, our listeners, to look for one, to listen, subscribe one, which one would it be?
Boy, I mean, so we have Moral Matters, 43cc. I just did the WCC podcast. All of those are interesting in different ways. But honestly, what I want people to do is to be curious. And I don't care if you listen to my podcast. I mean, that would be great. And I think there's a lot of good information out there. But be curious about the work environment that you're in. Go find any podcast that you really feel speaks to you, and listen to it. And don't limit yourself just to healthcare. I mean, if you look at our guests, they're from all over the place. They're not just from healthcare. They're from law, from the military, from business, because we have so much to learn. And so I really think that a relentlessly curious, broad education is the best thing that we can do to get healthcare to a better place.
Yeah, yeah. Thank you, thank you, Wendy, for all the work that you have been doing and for joining us today in this amazing conversation. And I just want to share with everyone, it has been a pleasure, and I'm sure that people will be interested and want they will reach out to learn more about this. So, thank you, Wendy, and thank you everyone for joining us today. And see you all next time.
Thank you so much. It's a pleasure.